He's there for a follow-up from a fractured motorcycle accident. This is a chest x-ray in, I believe this is September 2010. What does it identify to you as a heart doctor?
The x-ray is found to be normal. In other words, somebody has a car accident, a motorcycle, especially a motorcycle accident. You want to be sure there are no broken ribs, there's no hole in the lung. A lot of times from sharp or blunt trauma, the lung is like a packed to the air. There's a little leak in there, slow leak like a tire. And what it does, it keeps on leaking and leaking slowly. Every time you take a breath in the air, it leaks into the chest and got nowhere to go. So a few days after, if it's a small leak, the air fills with lung and in theory could push the heart the other side. So you want to get an x-ray to be sure that there's no what's called pneumothorax. You want to be sure there are no ribs fractures, no pneumothorax. So what they are saying, lungs are clear, no issues. No pleural effusion, no pneumothorax. That's where the one you are. Pleural effusion could mean blood. You break something, there are a bunch of small blood vessels in there. In other words, the x-ray was found to be normal, which is the right thing to do in this gentleman after a car accident, motorcycle accident.
Your Honor, if we may have a moment, I'm going to take over the AV. Lock off so you can have it smooth.
Okay, so normal chest x-ray in September 2010, right?
That's correct, sir.
Chest x-rays, is that important for you when you're determining the health of a patient's heart?
Very important, yes.
What kind of things could you see in a chest x-ray if the heart was sick or things like that?
First of all, you have to have symptoms. This gentleman did not have any symptoms, no complaint. On a chest x-ray, you will be able to see the cardiac silhouette is enlarged. So failing heart, the heart is not working well, gets big, it gets a bit lazy. So, and also then we have the effusions, the water left or right, or it could be blood after trauma, or it could be air in such a way. Throw this in really quick. That's the heart. Left lung has got two parts, up and down. Right has got three, and that's the chest cavity. So, sometimes you see a big heart, the heart is like this, that's a failing heart. He doesn't have that. Sometimes you see air from here to here, and then what's called, that's a pneumothorax, he doesn't have it. Or you see effusions, water, which could be blood. So, to summarize, his x-ray is normal.
Okay. Can you pull up 95.33? Now, in 2010, Dr. Arenas did a general physical exam as well, correct?
That's correct, sir.
Okay. He also checked his cardiovascular system during this physical examination, did he not?
Yes, sir.
Okay, can you go to the next page? And this is 95.34. Take us through that, doctor.
So patients come to you and they complain if they have a problem. I mean, we all know that. So then you have an objective physical exam. You talk to them, then you examine them. So what we're seeing here, cardiovascular, everything, nothing is abnormal. First of all, there's no X in there. That's pretty simple. Everything is WNL, within normal limits. In other words, his medical records, which is the only thing we have about this gentleman right now that's objective, shows that he was normal. And this comes from his treating physicians. Nobody knows him better than his treating physician. So he decided cardiovascular, so his heart, as well as the vascular system, everything is normal. In other words, cardiac size, normal, heart rate, rhythm, pop, 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 pop. That's not what he's got. The rhythm is okay. Heart rate is okay. He's got good pulses. Heart sounds. Loop, doop, loop, doop. Everything is normal. We listen to their chest. We've done this for years. We know the way it sounds.
Doctor, 1 second. Number 6, peripheral pulses. Can you tell us what that means?
Patients come to you for physical exam. Lay down on the table. Those are the femoral pulses. Those are the popliteal pulses here. And those are the pulses. It's called DPDT at the level of the foot. They're all normal. Everything is normal.